Now, at the time of class starting, we are doing regularly Vande Mataram. Now it is time to Vande Mataram. Vande Mataram, Vande Mataram, Sujalam Sufala, Malayaj Sitala, Sasyasyaamalam Mataram, Vande Mataram, Suprajyotsna Pulakitayamini, Pullakusumita Drumadala Sobhini, Suhasini, Sumadhura Bhashini, Sukadam Varadam Mataram, Vande Mataram, Vande Mataram, Vande Mataram. I am requesting Mr. Venkat Narayan Mahodaya to continue the Prarthana, session starting Prarthana.
Sarvebhyo Namaskaraha. 1 minute meditation, please. Three times Omkar. Om Gananam Tva Ganapatigun Havamahe Kavim Kavinamupamashravastamam Jeshtarajam Brahmanam Brahmanaspata Anashunvannotibhissidasadanam Om Shri Mahaganadhipataye Namaha Om Prano Devi Saraswati Vajebhirvajinivati Dhinama Vidyavatu Om Shri Mahasaraswatyai Namaha Gurudeva Gatir Gurumeva Bhaje Gurunaiva Sahasmi Namo Gurave Na Guru Paramam Shishurasmi Guroho Matirasti Gurau Mam Pahi Guru Jnananandamayan Devan Nirmala Sphatika Kritim Adharam Sarva Vidyanam Hayagrivam Upasmahe Shruti Smriti Purananam Alayam Karunalayam Namami Bhagavatpada Shankaram Loka Shankaram Shankaram Shankaracharyam Kesavam Badarayanam Sutra Bhashya Kritau Vande Bhagavantau Punah Punaha Ishvaro Gururatmeti Murti Bheda Vibhagine Vyomavat Vyapta Dehaya Dakshinamurtaye Namaha Asatoma Sadgamaya Tamasoma Jyotirgamaya Mrutyorma Amrutangamaya Om Shanti 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 Matrudevo Bhava Pitrudevo Bhava Acharya Devo Bhava Atithi Devo Bhava Om Sahana Vavatu Sahanau Bhunaktu Sahaviryam Karavavahai Tejasvinavadhitamastu ma vidvishavahai Om Shanti 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 Harihi Om Shri Gurubhyo Namaha Harihi Om
Dhanyavad Mahoday, Sri Gurubhyo Namaha. It is the Upaveda of Atharvana Veda. From 5000 years, Ayurveda is using in India. We are learning about Ayurveda by Kavita Agarwal Mahodaya. I am requesting Mr. Venkat Narayan sir to introduce today's resource person Kavita Agarwal Mahodaya.
Namaste, madam. I feel happy and privileged to introduce Dr. Kavita Agarwal. She is a postgraduate in Samhita Basic Principle in Ayurveda, presently working as professor and HOD. She has about 25 years of teaching experience. She published several articles in national and international journals. She chaired several Ayurveda conferences. She has revived Sharpani Samhita and Harit Samhita. With this brief introduction, I request Madam Kavita Agarwal to take over. Thank you.
Madam, you are not audible, madam. Your phone is in off. Your microphone is in off.
Madam, we can't hear you.
Excuse me, madam. Your voice is not audible.
So you continue on your mobile and mute your laptop.
Now I am audible?
Yes, ma'am.
Okay, we will start. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Gurur Sakshat Parabrahma, Tasmai Shri Guruve Namaha. Angirajamadagnishcha Vashishta Kashyabo Bhrugu Atreyo Gautama Sankhya Pulastyo Naradosi Agastyo Vamadevascha Markandeyashvalayano Parikshir Bhikshuraatreyo Bharadvaja Kapinjala Vishwamitra Shmarathaucha Bhargavascha Manobhij Gargya Shandila Kaundinyo Varshi Devalagalavu सांकृत्यो वैजवापीश्च कुशिको बादरायणः बडिशः शरलोमा च काप्यकात्यायना विभो काङ्कायनः कैकशेयो धौम्यो मारीचकाश्यपो शर्कराक्षो हिरण्याक्षो लोकाक्षो पैङ्गिरेव च शौनकः शाकुनेयश्च मैत्रेयो मन्मतायनि वैखानसा बालखिल्यास्तथा चान्ये महर्षयः. The shloka which I have just recited, it is in the Charak Samhita. Actually, what I get disturbed when young generation, they start searching Ayurveda in Wikipedia, it says it is pseudoscience. So how that can be, when I was searching on that and how that justification can be done, in that I got this shloka, where all rishis which were in those days, how ancient. One of the things, the name which are recited over here, they all give you the idea how old Ayurveda is, because the shlokas start itself from the Angira, Jamadagni, Vashishta, Kashyapa, Bhrugu. All they are from Satyug, Treta Yug, and Dwapar Yug. So Ayurveda should be, it is, we can say from this that it is since the life journey has been started on the earth. Because when there is a body, if we don't plan it properly, then we don't follow our regime, which Ayurveda called Ahar, Nidra, and Brahmacharya. If we don't follow it properly, then it is but obvious that we will fall sick. So the ancientness of the Ayurveda will be proved from this shloka, because all these rishis, the reference come that when the Charak Samhita was written, Charak Samhita is the first book of Ayurveda which give you the idea of the life sciences, that how you can cure your disease, or more or less I can say that the evolvement of medical science, the first authentic book which we get nowadays. Yes, it is not absolutely 100% how it was in those days, because we know there are several invasions in our country and there are a lot of changes on that. But it is the first book.
Mahodaya,
And
your window is not vertical, it is horizontal.
yeah, pardon?
Now okay.
Okay.
Now again it is getting horizontal.
Okay.
Oh, okay now.
It
Okay
is
now.
good. Okay.
Sorry.
So this all has come, and the Charak Samhita started with the symposium, which nowadays we call that. All the learned person who has the knowledge, they gather together and they there share the views. And these all rishis, they are specific masters of the parallel contemporary sciences which are going in India. And out of that, Agnivesh was the first person. Agnivesh, because the old name of Ayurveda was Agnivesha Tantra. Charak Samhita's first name was Agnivesha. So the shloka comes that Agnivesha Krute Tantre Charakaha Prati Sanskrute Drudabala Sampurite. Because why these changes has come? Because our lifestyle that always, as the time passed, they change. So there should be updated versions of all these Samhitas. And Ayurveda has accepted all the knowledge system which are present in those days. Just like Jyotisha, there are several references of the Jyotisha, like in this nakshatra, you have to collect the medicine, or in this nakshatra, you have to give the medicine. Just all of us maybe nowadays aware of the Swarna Prashan Sanskara, which is taken place on the Pushya nakshatra, because it is supposed to be the Punya nakshatra, where the potency of the medicine, the effective power that get increased. So Jyotisha they have incorporated in that. Then Sthapatya, that also incorporate, because while your pharmacy, your sitting arrangement, your water management system, your excretion, waste product management, all they have given the significance of that, and they have followed all the rules which are given over there. Then there is Muhurta Shastra also, they have accepted that on which Muhurta, and according to that, they have given the reference of Aushadha Sevan Kala, which is the unique feature of the Ayurveda. Because you might have, if those who have taken the Ayurvedic medicine, they might have seen that Ayurvedic consultant, they ask you that just take this medicine prior food, after food, or early in the morning, or at the going of the bed. It is not like that allopathy that say twice a day, thrice a day. It is not like that. So they have found that. ethical practice also in those days when there is just evolving. At that time they have given the references that nowadays, which we call in medical sciences Hippocrates oath, which we all medical students take when we take the admission. That Charaka oath is there, and it is surprisingly we will found it is just a translation of that original Sanskrit oath which they have now counted out. Then Ayurveda has accepted the mantra chikitsa which was in those days, because there are three streams in Ayurveda: Adi Bhautik, Adhyatmik and Adi Devik, and Adi Devik aspect is taken care by that mantra chikitsa. So all the science, and more or less Ayurveda itself says that whenever, in whichever era you are treating your patient, at that time you should consider all the existing knowledge system and you should utilize it. So sometimes the query comes that how can a Ayurveda person use X-ray, or how can they use the sonography and all that? Because X-ray and sonography are not related to any one stream of medicine. That is just an invention. That invention, which your readings they give it out, you can use it in your way according to your concepts. So with this introduction, we will now enter in the actual Ayurveda system. Ayurveda, again, it has accepted Sankhya and Vaisheshik also for the to prove their whatever their theorems now or postulate which we nowadays come, which Ayurveda described as the Siddhanta. In that Siddhanta, they have taken Tridosha Siddhanta. First we will see in 5 minutes the Siddhantas accepted by the Ayurveda. Tridosha Siddhanta. All of us might have heard the Vata, Pitta and Kapha, but there is a very wrong interpretation in our mind that Kapha is the cough coming out of the throat, Vata is the Adho Vata coming out of the anus, and Pitta is just digestive Agni. If you think like that, or any Ayurveda consultant they think like that, there will be a mistake in interpreting the things, because Kapha, Pitta and Vata, they are not the entities to be demonstrated. They can be judged by the working, how they are. There are two things: one which are demonstrated in the laboratory, and with that you are able to know, and second, from their working pattern, which we call it Sanskrit as a karma sapeksha. That karma sapeksha we can use it out. Or when we go to the very minute level, then we will come to know that kapha is any entity which is just like a binding or giving the stableness, tirata, which is giving, that is called kapha. Pitta is supposed to be the changing, even if we call it as a digestive power. What does it do? It changes your food to the asesimal form, which is nutrition, your body can take it out, and the excretory part which can be thrown out. So the transformation power or the transformation element or transformation process, all we can call it as a pitta. And vata is vata gamane, whatever the movement, because without vayu, there cannot be the movement in anything. So any movement, even when our blood is circulating through our system, that is done with the help of Vata. So the first Siddhanta was accepted as the Tridosh Siddhanta. Then, as it is so ancient and it is derived from all our Vedas, its name is also Ayurveda. So they accepted the Pancha Mahabhuta concept, and they have given the evolution theory, that how the human body evolves, that also is given on the Pancha Mahabhuta concept, where they think that the basic two elements are Purush and Prakriti. Purush is inert, which cannot act by itself, and Prakriti is a Chetana Dravya, which make it as a stimulant. When they both combine, then Avyakt. First, they are not in the form which can be manifested, and after that, it is just human tendency. If somebody don't notice us, then what we will do? That we will make some movement, we will tell something, or we will make others realize that yes, I am there with my special abilities. That is called Ayurveda as a Mahat or the Ahankar. Ahankar, which Ayurveda accept, it is not just an ego. It is your acceptance, your self-awareness or your self-consciousness, which give you the feeling that yes, I am there. If somebody asks, who is Kavita? Is my body is Kavita? Tomorrow if I am dead, nobody, still people will call, yes, Kavita was there. But the Chaitanya factor which make me that Kavita walk like this, Kavita talk like this, Kavita explain like this, that thing Ayurveda concept as a ahankar. And then for the evolvement of the body, Garbhava Kranti Siddhant that is given over there, and they called is that all the Pancha Mahabhuta, Prithvi, Agni, Jal, Vayu, and Akash, those all five have the Pancha spatial Tanmatra, which are Shabda, Sparsha, Rupa, Rasagandha. And that those all Tanmatra, Pancha Mahabhut indicates Pancha Tanmatra, and Pancha Tanmatra, they indicates your Pancha Jnanendriya, which we all are aware of that eyes, nose, tongue, ear, and skin. And then by after Pancha Tanmatra, we all know that Pancha Tanmatra are active in your fetal form. When you are in Garbhavastha also they are active. We know the Abhimanyu story that he has, his mother was listening to Arjuna when he was taking the Chakravyuha and all that. So the Tanmatra, they get activated in Garbhavastha only. And after birth, Pancha Karmendriya start. We know that when the fetus come out of the uterus, first thing we see, unless and until the child cries, we don't see that. We all are afraid if everything is all right. And once the baby cry, that means the Shwasa has started taking it, and life other than mother also they say. So this whole Prakriti, Purush, Avyakta, Mahatankar, this they have taken. Then unique concept of Ayurveda is the Shadrasa. Until now we accept it as only 4 taste we are knowing: sweet, bitter, sour, and all that. But Ayurveda considers it as a Shadrasatmaka. So these basic Siddhantas has been accepted by all the Ayurvedic physicians, and then they have given a beautiful definition of the health centuries, or I will say yugas before they have given. Even WHO's health definition was just prior 20 years. It was incomplete because they are not accepting mana as there in that. Now they are accepting that there are also psychosomatic diseases, where if there is disease in your body, you get the mental disease also. If you are not mentally stable, then you get the physical diseases of. So only 25 years back they have accepted now the existence of manovagyanik manasik vyadhis also. But Ayurveda's definition is samadoshah samagnischa samadhatu malakriyah prasannatvedriya manah swastha itya abhidhiyate. Samadoshaha, because these three doshas, the sthiratva giving, transformation, and the changes, and the excretory thing going out of the day, that equilibrium should be there, which they called is as a samadoshaha. Then the samagnischa, the concept of Agni, that the transformation with the help of, if it is in the food material, they called is at the Pitta. If it is in the manasik level, better, because we all know Sattva Rajatama are there. The equilibrium of Sattva Rajatama is also much needed, because if your Rajoguna is more, always you are taking angry, you are continuously moving, unstable, then that will give you the anxiety disorders and life become miserable. If Tamoguna is the Jadatva will come and you will just sit over there, you are least bothered about the things and all that. So it is also not good. Nowadays, if the too much sattva is there, then also your day-to-day activities, this materialistic world, it becomes difficult for you to manage it out. So equilibrium of that sattva rajatama is also needed. So samadosha samagnisha, and Ayurveda has the concept of saptadhatu: ras, rakta, mauns, med, asthi, majja, and shukra. Ayurveda says that whatever ahara rasa means food, we take it out along with the water also, and not food and water only, because Ayurveda says in three ways we take in inside, that is food, water, and the shvasa. That also should be gone under the process of Agni. Water also should be gone through the process of the Agni. Then only it is healthier. Nowadays, the dietitian and food nutrition consistent, they just say that drink as much at all water you can take it out, so that you are always hydrated. No, Ayurveda says that excess water, then what will happen to the Agni? We all know, if we sprinkle or put water on the Agni, that Agni get vanish, or that will be diminished. So it is also not that accepted. Only for the charvana, to making the food particle assembling, and they are analyzing the water is needed. That much water should be. There is the udakapan vidhi also is there. How much water you should engulf, when to take it out, when not to take. The basic they think is udakam ashvasakaranam. We have the tradition that whenever somebody comes here, we immediately give him the water, because our tradition has been come from the Ayurveda only. The person might have faced some traffic problem over there, or while driving also. So whenever he enter the home, we give the water, because Ayurveda says udakam ashvasakaranam sreshtha. Sarva pratham we give them the ashvasana, that yes, okay, now have a seat, take a water. And we all know that we drink the water, we feel, oh, whoosh, now I am comfortable. So that the method of that also given. Annapana sevaniya adhyaya is there, that nowadays whenever we go in any buffet or something, we what is that, in last we eat the dessert or sweet. No, Ayurveda says it is not recommended. You should go with the shadrasa siddhanta, like madhur, first you eat the sweet, then amla, sour, because when we eat, our kshuddha, our jatharagni is pradiptaha. When we give them the material to digest, which take more time or more effort, that is madhura. So that you should give immediate to that, so that your dipta agni will digest it properly. So the sequence while eating should be madhura, then amla, then lavana, then katu, tikta, and kashar. Here katu is not just like we say it bitter, but it is the spicy one, which is so in between that. So madhur will give your stomach a good lining, so that if you eat spicy and all that, so that that will not harm your gastric mucosa of the stomach. And in the end, they say it as a, you should eat kashaya, because kashayik shalan, because whatever you have eat, that should have been a proper blending of it with the digestive juices, and that should move it out. So this ahar pana vidhi and the udaka sevaniya vidhi, they have given it very nicely in Ayurveda. Then not only that you get the nutrition, is it okay? It is mandatory, it should be, but equally important is the excretion, the waste material that should be timely excreted out. Nowadays we see there is a lot of patients with the constipation, and ask them, one movie was also come over there, the Pa, where that Amitabh Bachchan asked that Deepika Padukone and all that. But yes, now people are facing the problem because the food habits have changed. Many people, they don't sit properly on the ground stair, and Western commode they are using. Western commode are useful in Western countries because they have the dietary habit of taking the food in sitting position on dining table. But in our India, we have the Utkatasana. We sit on the earth stably, and then so for us, for our digestive system, the proper motion position, traditional our position is mandatory. Then only you are complete, because that position gives the peristaltic movement to your rectum and intestine so that your undigested, unwanted particle can be thrown out. CSR Prabhu has very good given demonstration in yoga teacher that how we can aggravate that excretory procedure of the body. Then prasannatmendriya manaha swastitya vidiyate. If we feel happy, nobody nowadays we are dependent for our happiness on the external factors, that how people are liking me. If they give me the please comment, then I will feel, or if I post something, then how many likes are coming over there. Is it necessary? Our happiness we have handed over to the others, and then the reverse also, vice versa also. That should not be there. So samadoshaha samagnischa samadhatu malakriya prasannatmendriya mana swastha iti diyate, who is disease free, that has been given over there. How the journey of Ayurveda has set it. Many are people, they think that just it is Atreya Punarvasu, Bharadwaj and Indra has given and all that. Yes, they it is written in like that, but we have to take it in the rational way. They not by the shabdik, just how the words say. The Ayurveda has developed by the observational studies. Nowadays, how many research, any among our contestants, if they are from the research background, they might be knowing that if you take any drug and you want to see its efficacy, what we do, that we give, that is called the clinical trial. We give them to the patient, patient or voluntary, we recruit the persons, we give them and see the parameters, how we act and all that. Ayurveda has done this way before prior. Observational say, from nature they have seen, and how that has been grown. Amazing if you find it out. They have seen that when the cat, so her stomach is full and she feel nauseating, extra overeating she has, and then she do? She goes and eat the grass, and after some time she vomit it out. So they, with that observation, they come out that yes, if undigested food is there, that should be taken out. That otherwise that will harm your body. Then other one bird they have seen, which have a long beak, which and when the excretory material is not coming out with the beak, he put the water in the anus and the fecal material comes out. So the basti or the virechana, that concept has been come over there. Then vamana karma, that has come here. So they observe all these things, and then they see that the vast, just like tomorrow we are taking the medicinal plant. So I will tell you all the how the medicinal plant study has been evolved, that we will cover it out. But in between that has come, so I had explained you. Then how nowadays we have the dissection table, we have sonography machines, we have ECG, MRI and all that. How Ayurveda has come out. In Sushruta Samhita, there are 3 basic Samhitas which give you the idea of the whole Ayurveda. One, the medicinal part or Kai Chikitsa, that is given at the Charak Samhita, which I was talking just a few minutes prior. And now the Sushrut Samhita, which gives you the surgery. All of us knows that the Sushrut is called as the father of surgery. Why? Because till when Britishers were ruling over here, the rhinoplasty, Britishers see that in near Pune, one Urai Kanchan place is there. There, one barber was there, and in those days there was a method of giving punishment, that cut his nose and all that, so that he we know that Shitupanaka also, na, like that. So he cannot go in the public. Then that barber has taken the flap of the thigh muscle and done the surgery over there and restore that make the basic of the plastic surgery. So Sushruta has given the whole procedure, how the dissection should be there. They the science was in the evolving state. They put the body in the running water, and the layers they take it out, and thus they got the knowledge of the internal body also. We can see that place where the Sushruta used to do in the Shashwamegh Ghat, where it ends in the Varanasi. We can see the beautiful place over there, and we will feel amazed that centuries ago our ancestor rishis, actually our rishis were the scientists only, they have developed the method to see the inner thing. And even one Dhanvantari Koop is also there, where on each direction, we all know that there are 8 dishas on the Urdhva and other 10 dishas, but Agneya, Nairutya, Vayavya, Ishanya, Northeast, and all that, East, West, North, South. All those direction, from the single coop, the water comes it out. I will request all of you, if you get a chance to visit over there, just see, then our trust on our science will be increased. Yes, what they say, it is like that. Then Ayurveda tells you that you should not stick to what they are so progressive, and they are always open for the update, that they themselves says that Sanskarta kurute Puranam cha Punarnavam. According to the era, according to the things, whatever you know, you should do the research, and you should explore your thing and add some newer things, so that it will be more beneficial to that era. All of us know, just 5 to 6 years back, we have faced the Corona Kal, and all of a sudden Ayurveda comes in the picture. Why? Because all of the medicine, even the medicine science, which is now developed over here, all medicines will come from Ayurveda only. All hard drugs, you will surprised to hear that the first in the medical history or human history, first drug was for acting on the heart was come from Ayurveda, which is called Vrutpatri. That has been then named after that as a digitalis. And then the heart medicine has been evolved on that. Unfortunately, Ayurvedic persons, they have not done the research, and they have not the amendments according to the era, the demand of the public, diseases, how they were manifesting, they have not done that. So it has gone over there. So these medicines have, you all of you might be knowing the glycodine. These all codeine drugs, Vasa, our Adha Toda Vasika, the name, botanical name. The medicine has come from there only. So Puranam cha Puranarnava. Then we will come to know the specific things. Still, all the pathies which are nowadays existing, they don't describe about the Riticharya, Dinacharya, Ratricharya also. Garbhini Paricharya, Rajaswala Paricharya, Sutika Paricharya very well. Because Ayurveda, according to the need, they give you the all the direction of the they give you the Riticharya also, and Dinacharya, that how in Dincharya we can say it from morning 6 a.m. to 6 p.m. From 6 a.m. to 6 p.m. what should be your regime, what things should be done first and what thing after. Nowadays our people, they take it cup of the tea first and then they go for the defecation, because we have made the habit like that. But no, body has its own rhythm, they have make it out. They have to it has its own protocol. We are disturbing it and then we are falling we are getting the diseases. So the dincharya that is given, then evening 6 to morning 6, that is called as the ratricharya. There are several protocol they have given. How in next lecture we will be going for that. Now we will get taking the all the glimpses and specific things. Dincharya how should be, that will be we will be you will be hearing in next lecture. Then Ratricharya what should be, that will be. Then Rutucharya, we all know that now the Vasant Ritu has come and many of us, they are getting the complaint of running nose, cough and all that, because it is the Kapha Vilayan Kalaha. All of a sudden the temperature increases, we don't give our body to get stabilized, we just start sleeping in AC or cooler, and we start drinking freeze water. Nowadays, the people don't take that earthen pot, matka and all that. They start with that. But there is the golden rule has been given by Ayurveda, all the rishis and acharyas, that whenever there is a change from one ritu to another, you should follow a specific reason. What will be the last part of that ritu, last 15 days, and the which ritu is coming next, that's initial 15 days. That 1 month you have to be very cautious, and slowly you have to go, just like with the young girl get married and all of a sudden from maternal side she goes to her in-laws side, then she find it difficult. Like that, our body, if we don't follow that drawing, that the ritucharya pattern, slowly you have to withdraw of the pass away ritu, and we have to slowly, some things we have to find. So specific ritucharya pattern, that also we will say in the next. Then the garbhini paricharya, nowadays none of the female, they listen it out. If you say that you are pregnant, so in the evening don't go out, or in Grahan Kala, you don't cut it out, the vegetables and fruit, or like that. They don't hear. But if we get the patients and we go in the deep history, that why this cut a leaf is there, palate is cut, palate is there, why there is a scar or something like that, and in several patients I have found that there is the history that in Grahan Kala they have not found. There are sometimes that Garbhini eclampsia, she all of a sudden while delivering or in 8 months, they start getting the convulsions. And because all these effects, they don't come it immediately, so people don't trust it out, that yes, yesterday I went in the evening outside on that square, and now I am starting. It gets some time, because that is called the incubation period. Now the present science also says that if you just like you get the exposure with the infection and immediately after 10 minutes you start, no. Even someone, we are traveling in the bus, if someone has cough and cold, then after a few hours, if we are whole night journey, then we feel that yes, I am also getting the infection. So there is an incubation period which give that. So Garbhini Paricharya is very beautifully explained in the Ayurveda. Then Rajaswala Paricharya, nowadays we don't follow that, how the regime should be in your menstruation cycle. What is its importance? Is it necessary, or it is just they have said it out? No, I have seen several patients nowadays after 40-45, many are females, they are removing their uterus. Why the need is there? Because we are not following that Rajaswala Paricharya. After some days, after deliveries, after Sutika, you have to follow that. In our traditional, we used to go give that Gond laddus, and you have to cover the your ear passage. You have to put the scarf on your head and all that. Don't go in bright sunlight. Don't go in windy atmosphere. Don't sleep in the AC. All that. Now females, they don't follow it out, and after then 35 they come with the joint pains and whatnot. Several things with that. Nobody is trying to understand why all of a sudden there is a rise in that, because our acharyas, they have given all these things, how we can. And the beauty of the Indian culture was the Ayurveda was in our custom and traditions, in your food habits. Just like when putting the tadka, we put what? We put mustard seed and cumin seeds, rye and jeera. Why? Because every oil is not 100% suitable to your body. We know in South India, maximum our cooking recipes, we use coconut oil. In North India, we use mustard oil, sarson ka tel. And in middle belt of the India, MP, Maharashtra and all that, they use groundnut oil. Why? It is needed also, because according to the temperature, according to the Anup, Jungle and Sadharan Desh, all that put over there, according to that we use, right? So if in putting that mustard seed, putting some udid dal over there, putting some our tadka, we do the murchana of oil. What does it mean by murchana of oil? That the bad or the harmful things of that oil that will be reduced, and the properties which are beneficial for our body that will be taken in out. So we put the tadka. We don't put just like Western, we put that olive oil just like and mix it out. None of the recipes are like that. We always give the tadka. So Ayurveda was in our day to day, in our kitchen, in our walking, talking, sitting, everything was Ayurveda. But unfortunately, with the invasions, they have made our mind to see that yours all things are wrong, and what we are telling you, you just follow it out. So that they have started it out. Then there is one more beauty of the Ayurveda was Anupan Kalpana. What is Anupan Kalpana? Those who have taken the Ayurvedic medicine, they might have seen that when they go to the Ayurvedic consultant, they just don't say that. Even other medical sciences, they don't say with what you have to take, with water, with milk, with honey, with jaggery, or any trikatu, or any sunti, turmeric powder, or anything. They don't say it because they don't know. Ayurveda has that Anupan Kalpana, that medicine which has been prescribed by the consultant, that should be taken with that Anupan. Many a times you might have faced that the consultant has given the medicine, Ayurvedic medicine, and the patient benefited. But the relative, if from that family, the other patient or relative take, they don't get the relief. Why? Because according to that person's body, the Anupana change. Why this Anupana concept has come in Ayurveda? Because you can use in 2-3 ways. One, according to the Anupana. Anupan means, now you might have understood, with which liquid base or something you are taking your original medicine or the prescribed medicine. That Anupana has, why Ayurveda has given that? 2-3 concepts are there. If you want to take that medicine to the specific organ, so we choose that special Anupana to go to that organ. That will take it. We all know the catalyst in chemistry, the catalyst concept, which do not act with anything, but that can speed up the procedure or the reaction, or that can take you to the targeted organ, or that can be the combine. If we combine it, the combining effect है ना, एक से भले दो. That also, that concept, with that also we can we can use that Anupana concept also. And third, why Anupana is used? That Anupana, sometimes, see, whatever thing has action, it should have reaction also. We all have the thing that Ayurvedic medicine don't have any adverse effect. No, dear. Think scientifically. If anything is acting, it will act positive and negative also. But what is beauty of the Ayurveda? Because Ayurvedic, you might have seen the formulation. There is not a single drug. There are the combinations, and with several years research after research, our acharyas has put those combinations, that if I don't want one property of that medicine, or that property will be hazardous to that patient, the second drug is added to that, and that will reduce it. Or I have to activate the active principle of that medicine, they have added. So there is, you will see any bottle of Ayurvedic medicine, you will see there are several drugs over there. The intercombinations or many drugs, why they have been added? For that purpose, that the adverse effect of drug that has been taken care of by the another drug, or to aggravate the activity or its intensity or its efficacy, all those things, interlinked things. And with that, they have come with the beautiful combinations. And so there is no adverse effect, side effect. It is not that the single drug, if you take the single drug, it has to be. But they have taken care by using Anupana. They have taken care by giving you the Aushadhi Sevan Kala. They have taken care of that by the combination. So several things they have come. Do you think they have, hypothetically, these things come out? No, it might have taken several years of observations. They have talked several permutation and combinations, that if I use this drug with this, how it acts, where it acts, how it is, and all that. So it is most scientifically there. Unfortunately, in between era, we are unable to establish because we have gone after the copying of the West. And that has tremendously hazard the Ayurveda. So these things had been given under. Like that, the golden rule, if anybody says that if I don't want to fall ill, what should I do? They have made it so simple, but none of us follow it up. What they say? Kshudha kale bhojanam, trishna samaye niram. When you are really hungry, eat only then and then. Nowadays, what we do? I have to go to office. My office is like in between. In morning, I have to take this. Then I will go there. In my lunch hour is there. Okay, your body will get adjusted to that. But what happens if you switch off the job, switch over the job? The different timings are there. So we have started, or whatever happens with the females, that I have to go, then I will don't get the time and that. So I will finish my lunch right now, though I am not hungry. No, because our body is super computer. It knows, it has set himself or herself to its own rhythm, when to start and when to stop. We do injustice with that. Kabhi subah khaya, kabhi dophar khaya, and what not. Even that happens with the timing, even on the quantity also. आज party थी, ज़्यादा खा लिया. Today I am feeling very lazy. I won't prepare anything, so I will put some biscuits and all that. We do like this. What will the body do? Because it has programmed itself. It has even our computer. It is programming like that. And if we remove your thing or give the miss command or inappropriate command, it start malfunctioning. So it is the human body. Nobody thinks like that. So they have given that when you feel hungry, eat only at that time. And when you feel thirsty, drink only that time. My sincere request will be all to the delegates right now, that just follow this simple thing and see how your body reacts to that. You might be knowing that prior 4 or 5 years, 2 Japanese scientists, they get the Nobel. For what? They have established the circadian rhythm. What is that? When to rise, when to sleep. And if you follow that, you won't fall ill. We are not knowing that. What our Ayurveda says. It has the several chapters on that. I just told you that we will be seeing in our next lecture how the Dincharya should be there, how the Ratri Churya should be there, and all those Charya patterns. Charya means how to behave, how to act. All those we are going to see in our next lectures. Then Ayurveda has given one also combined with that. Kshuda kale bhojanam, trishna samay niram. He says, who is always ill or who is maximum times healthy. They say, hit bhuk, mit bhuk, rut bhuk. What does it mean? See, what is healthier for your body? That is hit bhuk. If a person has been born and brought up in South, if all of a sudden they go to North and start eating those samosa and kachori and pudi and all that, what will happen? Imagine just. Or the north person, they come to south and they start eating all the way fermented food, or just like idli, dosa and all that. Each meal, I am saying, not once in a while or breakfast and all that. But Ayurveda's beauty is again more, they says, if these things happen, you have to go from one region to another. That also we will see in the next lecture. They have given the regime that how you should switch over to that regional food and how you can taper your own regime which your body has been adjusted to several. Because nowadays for job, आज किसी का in Bangalore, next day if transfer happens, they will go to the Delhi, then they have to adjust. See they how they have the vision, how they come to know, and how much research they have taken, and they have given that protocol that you should follow like this and you should go like this. Then one beautiful concept of Ayurveda is Achar Rasayan. What is Rasayan? I think everybody, all of us might be knowing Chavanprash. And that all ads start in the winter. Jhindu ka Kesari Jivan, Dabar ka Chavanprash and all that. What does it mean? That Chavan Rishi story was that he was very old and he wanted to gain his young age power. He has the formulation has been prepared by Ashwini Kumara. Who are Ashwini Kumara? Ashwini Kumaras are the physicians of Dev. Ashwini Kumara, they are two, Nasatya and Dasta. Don't go in the name. You have to see how that. Nowadays also we measure the power in horsepower only, right? So Ashwini Kumara, they are so much powerful. They can treat the devas also. So they have prepared that formula, and Chavan Rishi has got the just like feel energetic like the young. So that kalpa or the medicine which are supposed to make you two things. One, healthier, so that you can perform your day-to-day activities efficiently. That is one thing. And what Rasayana do? That second thing, it gives the proper nourishment. In my half an hour prior, when the topic has come, I had told you about the Sapta Dhatu. They are in the sequence. This sequence is also very meaningful. They have given in that sequence only. That why that sequence has been given, we will see in the next lecture. That is Rasa, Rakta, Mans, Meda, Asti, Majja, and Shukra. So, if one has to be healthy, then the nourishment should be from Rasa to Rasa, Rakta, Mans, Meda, Asti, Majja, up to Shukra. Because Shukra is supposed to be the, in our own language, in general language, we see that it is for the reproduction. No, that is the one aspect. The ultimate what nourishment you will give. That's why the Shukra, there is the progenesis. Reproduction could be there. Just like you can produce someone else in any creature which is existing on the earth. So from Rasa to Shukra, the whole nourishment should be given. Those dravyas are called the Rasayan. Hope you understand. And what we start doing, we eat in winter. And we don't follow even. Many are how none of the person they go to the Ayurveda Acharya and ask, see when they are doctor, I want to take the Chavanprash, how I can take? It is just dibba khola, then take, and you get the benefit. Just like fair after applying Fair and Lovely, how many people have gone fair? After eating Chavanprash, how many people they have become young? No, because the protocol has not been followed. And beside one thing, I will explain over here, that what acharyas mean just like we know, with the growing age, forgetfulness, dementia, imbalancing happens. These all things will be taken care of, so that your not only the quantity of life, but your quality of life also will be improved. For that, dravyas which are used, they are called rasayan dravyas. But here, these rasayan dravyas will take care of your body. What about mind? We have seen the definition. Prasannatmendriya manasvasthaiti avidhiyate. So how the care of your mind will be taken? By achar rasayana. We all know that yam, niyam, dharana, dhyan, samadhi, all those, satyam vada, dharmam chara, all these things come over in the nama japam guru. All these things come at the achar rasayana. And in Ayurveda, these achar rasayana are in two categories they have described. So I always go to my acharyas that how rationally they think it out. They think not only your patient should follow, but the treating doctor, Vaidya, they should also follow the Achar Rasayana. Then only the patient will get the relief. If the physician, treating physician, he is not following proper Achar Rasayana, then the medicine is not going to act. So our all Vedic knowledge, our coexisting science knowledge in that era has been taken in the Ayurveda with the expertise, and they have interpreted, they have seen the influence, and they have seen correlation with the human body. And with the observation, they come to conclusion these are necessary. Don't you think? Only body care if they have taken with the rasayana, what would have happened to mind? But for mind also they have done the researches and they have seen. Then you might have seen when you are angry or you are disturbed, if you eat at that time, what happens? You feel bloated. There is indigestion. They have observed this also. So they said, Tanmana Bhunjit. In our Vedic literature, what does they say? Maunam Bhojanam Kuru. Why Maunam? Because if once we all go to temples, prior going to temples, we see, yes, I want to do the darshana. I want to do the darshana. But as soon as we go in front of that ideal, what we do? We close our eyes and then we hold our hands and do. Why? Have you thought? Actual science is behind that, that when you are in the queue and when you are up to the mark, when you are in front of the ideal, you should see that ideal. And the moment you come in front of the ideal, we close the eyes, you should be able to visualize that. Then that is real darshana. Like that, when you take mauna bhojanam, your external perceptions or the stimulations, it should be reduced without criticizing the food. Oh, it is too salty, it is too spicy. Because the stimulation goes to your mind. The mind which is secreting, we all know CNS, central nervous system, brain give the command, and as soon as we see, if we see some sour fruit, just like tamarind or lemon and all that, the salivation come out. Because with your netras, that stimulation goes to brain, and brain immediately said something of eating has been coming out. Then it's it. Beside that, how much quantity you should eat. That also they have described. Why? Initial I have started. Kapha, Pitta and Vat. Vayu for movement, it will require some space. If you thus ke bhar diya, what will happen? That Vayu is not going to act. Pitta, Parinamana Kale. It has to transfer. We all know while that making chutney, if we put that jar overflow, can it be smooth chutney? No, you have to give some space. Then kapha, sthairya. If we don't put that some water in that while making that chutney, what will happen? It won't be finely, right? So these things happen. Then proper posture also they have explained. See how minutely they have observed all the things. Proper posture. When we sit on the ground and we sit, your spinal cord is erect, your whole digestive tract that is aligned. There will be free movement of your food from mouth, stomach, duodenum, the small intestine, larger intestine, and all that. They have observed it. Nowadays, someone will ask that there is no sonography machine. How they compute? That is the beauty. I told you in initial that they are based on the Karya Karana Bhav. There are two things, right? One, productive cough is coming out. That is one method. And second, continuously I am feeling some sticky and all that. Still cough is there. In both the cases, cough is there. How I see into the matter, that make me special. That is there. Then again, I want to give the glimpse of nowadays we see that there are the hormonal disorders. Many are people, they said, how Ayurveda don't know the hormone, because nowadays we are seeing and all that hormonal specialists, there is no. One beautiful chapter in the Ayurvedic literature is Ashtau Ninditiya Adhyaya, where they have not given the name of the hormone, but the function of the hormones, exactly they are given like that. Just like hirsutism, they say, the one who is more hairy, you might be knowing that if the estrogen level goes down in menopausal females, you will see they start coming some beard, hair, mustache also, and all that. The hairs coming out, and then if you go to consultant, they say estrogen level is down now because you have reached the menopause. Now progesterone has been started. Why? They have given it. The sign and symptoms. They have not even one beautiful shloka is there that even if the Vaidya don't know the terminology or name of the disease according to that era, but still he can be able to treat it out, because nomenclature is not important. The result, the roga nivrutti, disease-free state is important. How you use it out, or how you make it possible with your patients. And nowadays you see, we all know in Corona Kal, everybody is taking Dolo 650, Dolo 650, and the fever is gone. But it was a cure? No. Only temperature has come out. And yes, it comes down because the allopathy has been evolved like that only. So they have the single medicine. Whenever you get the fever, take this. Every time you take the allergy, take cetirizine, Avil, like that, anti-allergic drug. But is it with the Ayurveda? No, because Ayurveda says no two individuals are same. And all of us will agree something is different. ऊपर वाला never make two identical. इसीलिए तो everyone's thumb is different, everyone's eye color is different. For example, I am giving. So all people, they are different. Right? So Ayurveda gives you the glimpse of the customized medicine that you do the Prakriti Parikshan of each other. In next lecture, I will give you the Vata Prakriti, Pitta Prakriti, Kapha Prakriti. You might have come. Last year, government has made a campaign, Prakriti Parikshan of each and every Indian. So how it acts to your body, that has been taken care of. And the Garbhava Kranti, that is one also more beautiful explanation, or we will feel amazed if we go through that in the fetus, first month, second month, third month, 4 month, every month, how they have observed the things. In our tradition, we have said that she is pregnant, whatever she asks to eat or to go outside, that she whatever ichha desire she comes, that has to be fulfilled, because that ichha is, or desire is not of that mother, that is of that fetus also. As the individual life of that fetus has not been started, that has been interpreted or established by the mother, and mother asks for that. And so our traditional wear says in 8 months, in some customs 4 months, 5 months, they put several things in front of that pregnant lady and ask which thing you want, take it out. And they always keep her please, so that the fetal development should be proper. So in Garbhini Paricharya, when we will be looking after in that lecture, I will give you the details. What should be in first month, second month, third month, and all that. So this Garbhava Kranti, that how the fetal development, and up to, in our tradition, we say that in 8 months you should not travel. Why you should not travel? There are the researchers that the children which are born in 7 months, they have more survival rate. But in 8 months, it is comparatively lower. It is the observation. Why? Because they see one more concept is Ayurveda, that is Ojaha. Ashtame asthiri bhavati Ojaha. Oj goes from here and there. So sometimes that Oja is towards mother. You might have observed, you have felt yourself that in 8 months, some day you feel very energetic. Some day you feel totally dull, because Ayurveda says when the Oj part is toward mother, she will feel more energetic. If that part goes to the child fetus, then mother will feel dull. All these have been explained in that. So we have up to now, we have seen how the Ayurveda gives the evolvement of the life. What are the sciences has been accomplished in that, how the different methods of charyas they have given, what are their knows, and that. I have not touched to the medicine part. I have touched to the concept of the medicine, how a Ayurvedic physician choose the drug. That has been completed. And basic idea about the Ayurveda, how about its evolution and its development, or updated, how it has happened, and what are the need of the future development, that I had tried to cover in this lecture. I will be very happy up till now if there is a question and answer. I'm ready to answer it out. If anyone have, they can give me out. Or if there are no questions, then we can take some more part. But I will like, we have 10-15 minutes, in that we can take question answer. Yeah.
Leela garu, take over.
Thank you, ma'am. Any questions, please? Then raise your hand and ask questions. Ma'am is waiting.
There are no any hand raisings.
I think Narsimurthy raised hand.
Just he thanked only.
Oh, okay. I think Dr. Ketaraju Purnima has a question.
Yeah.
Good morning, Doctor.
Namaste.
Namaste. It was a wonderful session. It was an eye-opener. My, what I should say, doubt or otherwise, my perplexity is, despite such a wonderful developments in these areas, to begin with, in the ancient periods, suddenly in the last, say, 1,000 years or so, there has been a cutoff from our ancient systems, whether it's astronomy or astrology or Ayurveda study and all that. So, what steps are being taken now to revive them so
Yeah.
that that Ayurvedic medicine, then the corresponding other medicines go with the present trend and try
Yes.
to bring in first confidence level in the patient?
Yes. Right, sir. Absolutely right. You are. The Ayurveda is facing that challenge main because whatever written in the Samhita, that is absolutely right. But due to invasions in between, there are still whatever books we are referring, they are not 100% which are as original. So I had recited one shloka that Agnivesha Krute Tantre Charaka Prati Samskrute Druda Bala Sampurite. Though it is called the Charak Samhita, it was not 100% available now. There are missing parts or in between. So, and it is in the Sutra Rupa. We know the Sanskrit language, all the Ayurvedic literature is Sanskrit language. That Sutra Rupa in between, the linkage in between, they are lacking somewhere. So nowadays, the working happening in that, government is also acting on that, that this interlinkage procedures, because the edition, the books which are edited by the, unfortunately, on public platform, I won't be able to tell like that, but they have not taken the efforts that the original text or the authenticity, which I am copying from the manuscript, was that manuscript was original? They have not taken that efforts. They have just got the copies, hand copies, and they have published. So Charak Samhita, you will get of more than 250 different
Versions.
Yes, that one thing. Then second thing, the challenge which Ayurveda is feeling, that about the identification of the drugs. In our India, in every several miles, the language change. The same plant has been called by several names. And the unfortunate part, we all have gone away from the Sanskrit. If we all have been in Sanskrit, then the one Sanskrit name will be throughout the India. But as the regional language has taken over that, the regional names have come out, and the people, they have interpreted themselves. That was second challenge. Then third challenge come with the pharmaceutical companies. As the original drugs nowadays, they are either instinct, some drugs, or they are not available to that extent. They put the substitute drug. None of the Ayurveda literature gives you that authenticity that you should use the supplemented. One of the experience I will give you in Corona Kal, the Guduchi, Terminilla cebula, that drug has been so much widely used, Guduchi Ganvati, throughout India. All of a sudden demand has set, and they have used the different species of Guduchi. And people get the side effect. Here, who should be blamed? Pharmaceutical companies. But what happens? Ayurveda get defamed. Fourth, it is very sad part that even nowadays the people or the students who are coming to the Ayurveda, they come, I want to be doctor, I am not getting the admission in allopathy, so I will go to that. So the IQ level, I should not say this, but it is the fact, as I am since 25 years, I am in teaching profession. I know in first year, my main first challenge is that to create affection towards them to the Ayurveda, that you have come to Ayurveda, you will be doing graduation in Ayurveda, so you should learn it properly. Many year people, they go after. Then second, I have told that just like Dolo, you cannot give it to the everyone. Customize, there are several drugs in Ayurveda which are Jvarahara. You cannot give Tribhuvan to Kirti to everyone. According to the Prakriti, according to the disease, according to the time of the fever. In the morning it is coming, evening it is coming, or frequently after 4 hours it is coming. Punaravartaka Jora. If that is there, according to that you should change the day. But student, what they do, or the consultants or the pass out which are coming out, they are going after the formulas. That my ma'am is doing this, I will do that. They don't go for the thought process. Why my ma'am has chosen that drug, what effort she has done in mind to select that. They just come to in our OPD, they sit beside, yes, madam has done this diagnosis, and for this diagnosis, this is the medicine. That is possible in allopathy. That is not possible in Ayurveda. Even if the diagnosis I made it one, we have to do is according to, because I first concept is Tridosh. Vata, Pitta, Kapha, and their permutation combinations, several combinations will happen. Pitta, Kapha, Kapha, Vata, Kapha, and all those permutations you have to take, and you have to choose the drug with that. But yes, good part is that now government is making standardization. Government is trying to make universal identification of that herbal drug. That now in India, in few years, the single name will be throughout from Kanyakumari to Kochi. That will solve some problem, because if that drug identification will happen, the pharmaceutical companies has to put that drug only. Otherwise, they take the excuse that in our area, this is the name of that drug. I had work in pharma industry and left that job due to that only, because every time for quality check, I used to put the mark that this name is not given in my original text. How you can substitute? This happens. This challenge is there. Then one more thing with that Ayurveda, what government is doing, that government is doing the Punarujjivan of the Samhita. Just like in my introduction, they have said that Charpani and Harit Samhita, because I have to take the efforts. I have gone to the Continental Library in Nepal, in some Pune also, and in Jaipur also, and I take the manuscript and try to make it interlink with that. It is possible for me because the Guru Krupa only. Otherwise, I won't be able to do it. To find among several things, first the process of the research or the process of updation start with the authenticity only. Many are, they write it with a hand on the elder people, they get in any box the 200 300 years back that paper, and they write it nowadays, and they produce it as a manuscript. We have to find it out, and then we have to see, no, it is not that. Ink is showing, though the paper is that much old, the ink is showing recent one. So too much energy, too much money goes in that. And beside that, now the research protocol, yes, there is some Ayurveda has some excuses that they don't have to go to the clinical trial from the phase 1, because I said it is observation training. Since thousands of years we are prescribing those drugs, people are taking out, so directly we can go to the phase 2, because we have to don't go to the animal study. Otherwise, if any drug from allopathy it is coming, first we have to test it on the animal, whether it is suitable for the consumption. The research start from that, then the dose, and then efficacy and all that. But in Ayurveda, that is not needed. Good part is that So the studies are going, then the research for to prove it out, you have to go for the multicentric trials also, and that too of the different region. Like that, we say 4 metros in the 4 corner. So all the representation of the whole area, we have to take it out. Then third main challenge in research is the patient pool. In any allopathy college, in any allopathy hospital, you get the tremendous flow, the 1,000 government criterias. Unless and until you get the same result in 1,000 patient, you cannot produce the data. But it is possible in allopathy, one of their patient is more, and second, they don't go for the customized data. Here Ayurveda, typical Ayurvedic practice, if you have to do, then you have to take the Prakruti Parikshan also, their Nidra Parikshan also, their and all whatnot. And the same criteria, how many patient I will get it out? If I found that the patient is of 3 doshas Prakriti, Vata Pitta Kapha, then I have to see, even if the disease, I suppose I am doing on the rhinitis, I will get 10 patient of rhinitis, but how many patient having the 3 doshas Prakriti only I will get out of that 10? So the research hampers over there. Meetings are going on there, government is also considering, but according to the world trade now, they are more flourishing. They want that the whole knowledge should be given to them. They will do research and then they will make the money and they will give the formula. Just like they have taken the patent of turmeric, they have taken the bilwa, they have taken the gomutra and all that. But yes, we are optimistic. We'll see. We are hopeful that someday. And every pathy it flourish with the Rajashraya only.
True.
Prior this government, none of the government was looking after Ayurveda. Even if somebody goes to represent the case, they want to produce the data, there is no. Even since my graduation, we are struggling that Wikipedia should remove that pseudoscience word. But a general public cannot do it. If the government put that question that our traditional medicine, thousands year traditional medicine, how can you say it as a pseudoscience? Chal raha hai. Hope.
Last question, madam. I'll not take much time.
Yes.
I heard that in the traditional medicine, now government has taken a view that you can go up to operations, surgeries, certain level of operations and all can be
Yes.
integrated between modern and ancient medicine. Can you elaborate?
Yes, I had just, that's why I had put that Sushrut Samhita in that. I'd give you the example. Sushrut was Samkalina of Charaka, thousands of years back. They are doing all the surgeries. You will be surprised. They have given the instruments also, how you should make the instrument to see the Swara Yantra. Now is what we say, that's proctoscope, rectoscope, laryngoscope, pharyngoscope, gastroscope. These all are explained in that, in shloka. That how you can prepare, how the bulk should be there, how much the length should be there, width of which metal it should be, how it has to be sterilized and all that. So the GR has come that what are the surgeries they are described in Sushrut Samhita, Ayurvedic surgeon can do it. That is very good step. Because those surgeries are mentioned, all precaution. Even if what we say nowadays that ultraviolet rays make kiya most powerful sterilization, right? So they are doing this sterilization on Agni direct. You might have seen in villages or on that they put that flame on that direct flame.
Yes.
It get red hot and then they start it out. Agni karma.
Yes.
They are knowing that. Even anesthesia also, they have some drugs. Now we are not able to identify those drugs. Even for the what I say, bone surgery also, Sandhana Karani drug was there. Even for the removal of the foreign material, Vishalya Karani drug is given. But main problem is of identification. If we come to identify it, then there will be the huge change. And unless and until the pathy comes in first line of treatment, Ayurveda still is on the second or third. mainstream, unless and until you come in the mainstream, and as it is the Indian medicine, as it is the India's own science, unless and until in India it comes to the number one position of the pathy Indian peoples are using, we cannot ask other countries to do that. In China, maximum people, they use first line of treatment there is Chinese medicine, they take it out. In Sri Lanka, first they take that Tamilian, which they have specific treatment, they take it out. In Cambodia also, they take first that treatment. If their physician, that traditional physician, if it fails out, or with the life, that time span, he is not able to give you the result, then they switch over to you. But in my practice also, I see is they have tried all things and then they come it out. But what happens?
Madam, do you have Sanskrit as one of your subjects of study?
If you have to learn it out. Otherwise, the gist और वो अंदर की चीज तब तक आएगी ही नहीं. You won't be able to learn from that shlokas. Because
right now,
if you refer to different commentaries by the different authors, every author has his own analysis. And with that, he write it out. If you have command on your Sanskrit, then you take it from your jasna, that this shloka that refers or that gives me the idea of this disease. My patient, I am confident that my diagnosis is proper. And why I am not getting that? Then I have to decode that. Yeah. Where to pause it out, where I have to break that, the sandhi which has in that shloka. And when you do that, then you will fit. Yes, my acharyas are very correct. But that so you
must have Sanskrit as one of your subjects.
Yes.
Oh, thank you, madam.
Yes.
Namaskar.
Whatever good is there in my lecture was from Acharya Charak Sushrut and Bhagavad, and whatever they are mistake, they are completely mine. Keval Guru Krupa was there. Charakamadaha, Charakamidam, Charaka, Charakamudachate, Charakasya Charakamadaya, Charakameva Avashish. Thank you all.
Madam, next question is from Dr. Pramodini.
Yep. Even not questions only. I will love if you give me the suggestion for the next lecture that you should cover this part also. I will try to incorporate that also.
Namaste, Mahoday. Dr. Pramodini. I practice in the US, internal medicine, general physician. Like बहुत बढ़िया था आपका लेक्चर. तो मैं कुछ एक दो शब्द बोलना चाहती हूँ ताकि like I learned Ayurveda also after coming to the United States. I do internal medicine, but Samskrutam also. Last 4 years I graduated, and so I really enjoyed your lecture. So in such a short time you gave a gist of everything. Charaka, Shushruta and the Dinacharya and all that. So looking forward to tomorrow. But like the other doctor was saying too, America, that's what I went to. I did a couple of fellowships also, geriatric medicine and integrative medicine. They teach Ayurveda and Chinese, traditional Chinese, all those medicine. But like you said, same thing, the Western doctors were saying, in India, you people, you don't even respect your own medicine. Ayurveda is the last, like you said, people go try everything else, and then the last resort, last we try, okay, let's go and see. And that's what they were saying. Western medicine in our countries, we respect that. And Chinese, like you said, Chinese medicine, traditional Chinese medicine, TMC comes first. Then this, that's why I'm saying Ayurveda is so neglected. You people don't respect, and how do you expect anybody to learn from you guys? And you say, oh, ours is so ancient and we have all this knowledge, which is true. And like you said, all invasions, and very unfortunate, but also like you said, the government is making efforts, and like people like you, you are so dedicated. I can see you are so passionate when you are talking about patients, and the way you're teaching students, next generation, you are preparing new ideas. So I'm so looking forward to it, and very optimistic भविष्य में जरूर बदलेगा हमारा भविष्य। बहुत बहुत धन्यवाद आपको वैद्या जी, धन्यवाद।
Thank you very much for your kind
much.
words.
Thank you.
Hey, Leela ji, can you go for prayer?
Okay, sir. Okay, sir. Sir, Venkat Narayan, sir. Session ending prarthana.
स्वस्ति प्रजाभ्य परिपालयन्तान् न्यायेन मार्गेण महीषाः गोब्राह्मणेभ्यः शुभमस्तु नित्यं लोकाः समस्ताः सुखिनो भवन्तु। काले वर्षतु पर्जन्यः पृथिवी सस्यशालिनी देशोऽयं क्षोभरहितो ब्राह्मणाः सन्तु निर्भयाः अपुत्रा पुत्रिणः सन्तु पौत्रिणः अधनाः सधनाः सन्तु जीवन्तु शरदां शतं सत्यं वद धर्मं चर स्वाध्यायान् मा प्रमदः सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्। ॐ शान्ति शान्ति शान्तिः। ॐ पूर्णमदः पूर्णमिदं पूर्णात् पूर्णमुदच्यते पूर्णस्य पूर्णमादाय पूर्णमेवावशिष्यते। ॐ शान्ति शान्ति शान्तिः। सर्वे जनाः सुखिनो भवन्तु। स्वस्ति।
सर्वे जनाः सुखिनो भवन्तु। धन्यवाद महोदय। धन्यवादाः महोदय, कविता महोदय. We are very fortunate to know about Ayurveda basics and principles of Ayurveda, which are useful to our good lifestyle as a part of IKS. Thank you very much, madam. Then we are going to Janaganamana. जनगणमन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंधु गुजरात मराठा द्राविड उत्कल वंगा विंध्य हिमाचल यमुना गंगा उज्ज्वल जलधि तरंगा तब शुभ नामे जागे तब शुभ आशीष मागे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे जय हे। Sir, shall we?
Madam, there is a question from Dr. Krishnaveni Devulapalli.
Yeah.